Thanks so much for joining all. I am incredibly happy to welcome Sono Aibe, who is a past student, a former student. She got her master's in health science from JHSPH, now the Johns Hopkins Bloomberg School of Public Health, in 1988 in international health, and she's focused on health systems in that education and today. Since then, she's spent about half her career in reproductive health philanthropy and grant making, and the other half directing and implementing programs in the US, Asia, Africa, and at various NGOs. She specializes in promoting interdisciplinary policies and programs that link reproductive health and justice to environmental issues. And not surprisingly, her current work increasingly intersects with climate. So she spent the last few years at a private philanthropy in San Francisco, looking at how best to support partners to ensure that women's health and reproductive health do not fall off the global agenda, especially in the age of global climate emergency. So super excited to have her with us. Sono, I'm going to turn it over to you.
Great. Thank you, Kelly. And hi, everybody. Really delighted to be back at the school, even virtually, to talk to you all. And I hope this will be a lively dialogue today. I just have a few slides, and so I'll dive right into them. Yes, I just wanted to talk about the outline of this presentation. First, we'll take a quick look at where we are on global gender goals, and then we'll look at the various ways climate affects reproductive health. And then after that, I wanted to put forward some thoughts about what ideas we could promote when communities are planning for climate adaptation, and what actions we could advocate for to ensure that climate policies are gender sensitive and does not leave reproductive health priorities behind. So feel free to put your questions in the chat, raise your hand if you have a burning question. I hope this can be a very interactive session for everybody. So this year, at the recent UN Commission on the Status of Women meetings in March, Secretary General Guterres of the UN stated with urgency that gender equality targets for Sustainable Development Goal number 5 is severely off target. And he was absolutely clear that sexual and reproductive health and rights were being rolled back in many places. And in many parts of the world, the triple threat of COVID and climate and also conflict and the fear of slowing economic growth took a toll on women's rights and health. And Guterres really called on the world to push back against misogyny. So that was his strong call to action. But we also have to look at some of the progress that we've made and celebrate them, and also be aware of some of the vulnerabilities in that process. So we have increasing primary school enrollments among girls. We have declines in maternal mortality, except for maybe in the US, and then greater contraceptive use with rapid increases in countries like in the Francophone West African region, and in Ethiopia, there was a rapid increase in modern contraceptive use, even though they missed their mark, their target by 2020. Anyway, there's still a lot of work to be done there, but we have good progress. But on the other hand, in terms of labor force participation, women were much more vulnerable to job losses during the pandemic, and then some of them never returned to work, full-time work especially. And the International Labor Organization found that in 2021, women's employment dropped 4.2% between 2019 and 2020 compared to men, which was 3%. So women are being pushed out from the workforce and back into delivering unpaid labor at home. And also there's very little investment in the care economy. So their tasks at home just keep growing, and difficult for them to return to full-time work. And then preventable maternal mortality is still really too high, 300,000 women dying each year. And then half of these deaths are occurring in countries where it is already very crisis-ridden and very fragile, especially to climate change as well. And then we talk about women's political participation. Well, it's still very low. Only 12 of the 193 member states of the UN have women heads of state, and only 1 out of 4 parliamentarians globally are women. So we still have a lot of work to do to get women to run for office and lead countries and nations. So let's look at the climate crisis. It is here, it is right here and right now. You remember the cyclones that hit Pakistan last fall, and this was a photo from when it happened. So the news stories covered that 33 million people were affected, and satellite images were showing that a third of the country actually was submerged underwater at one point. And as of this March, there are still massive numbers of displaced people. There's severe food insecurity. Children are malnourished and they're not being treated. And only half of the funding pledged by donors has arrived in Pakistan. So who is responsible for climate change, and who are the ones suffering from these consequences? And where is the $100 billion actually of climate finance pledged at the Copenhagen summit in 2009 by rich countries to support these poor countries every year from 2020 onwards? So there's a huge gap in climate finance, as well as dealing with all of these disasters that are starting to happen everywhere. So let's look at some of the climate change impacts on health in particular, because we're all public health professionals here. And then think about reproductive health care as well, of women and girls especially. So malaria, starting from the left, malaria and other vector-borne diseases are expected to rise and appear in new parts of the world. So we know from experience what havoc the Zika virus caused especially among pregnant women. There's a lot of research that has shown the negative effects of excessive heat during pregnancy. So that result often in adverse birth outcomes, both affecting the mothers and the fetus. The mental health and the stress from climate change and then all the related disasters certainly can be severe and long-lasting for everybody. And young people are also experiencing what we call eco-anxiety, which is like a chronic fear that there's doom, that the future is doomed, and this overwhelming feeling of powerlessness and hopelessness that can overtake people. So that is a growing issue. And then there are droughts and floods, of course, both impacting food security, as we just talked about, and also very important is the clean and safe water supplies. And then floods and wildfires, of course, destroy healthcare facilities. And so the disaster teams may be there for the short term, but what about long term? How are they going to recover from a disaster of that scale? And then we have seawater rise, as you know, as global warming is happening, ice caps are melting and seawater is rising, coastal flooding. So when that happens, water seeps into the groundwater. So that impacts agriculture, but also the drinking water of people. And that could lead to hypertension and have adverse effects on pregnant women. And then I know a thing or two about wildfires because I live in Northern California, and I certainly have experienced it up close. Smoke pollution, poor air quality leads again to poor birth outcomes. So I tried to capture some of women's many intersectional roles in society. And you can look at each of these and imagine how climate change affects these roles and identities that women have at home and in their communities. So, for example, if you're a village health worker, then will you really be able to do your job and make home visits door to door in scorching heat or in the pouring rain where there are floods everywhere and roads are impassable? Or if you're gathering water for the household, how far do you have to walk in an extended drought to fetch that bucket of water for cooking and for washing? And if you're a farmer, do you have access to information, to timely resources to help you adapt your agriculture practices to these new climate conditions? So all of these questions, and we need to think about how to mitigate some of the threats. So if we were to ensure that reproductive health care and gender concerns are incorporated into government plans to handle this climate emergency, then these are the things I think we have to do now. We have to include reproductive health in climate plans and make those linkages for policymakers to understand how single sector programming could really miss important feedback loops and synergies. And we also really have to advocate for funding streams that allow flexibility to address these interrelated needs of communities that are under stress. And we really need to look at, pay attention to the needs of people of all genders in this context of climate crisis. So for all of us, we really need to steady up on climate change. There's a lot of information out there. There are a lot of activities that we can all be supporting locally and also globally. The good news is that every one of us could play a part in this, and we need to be engaged every day, thinking about how we could make change. We need to get public officials into office who believe that climate change is real and are proposing serious solutions with a sense of urgency to address them. We need to advocate for gender responsive policymaking to make sure that the needs of the most vulnerable are being met. And they should be, the activities to address them should be in every climate policy and plan that's being created right now. The climate sector has also been working somewhat in a silo until recently, and so we need much more dialogues to get climate experts as well as global health and development experts together, talking to each other and learning from each other. And they have to help us, the public health community, to understand what are some of the scenarios of climate change that will be coming, and how can we make appropriate plans to make sure that healthcare service delivery systems are not disrupted, they are more resilient, and we could plan for backup plans for when things fail. There's definitely an opportunity to extend life skills education for young people. And I feel that it's a very good opportunity to integrate now some of the knowledge that young people need today to navigate climate justice, as well as sexual reproductive health and rights and justice. So these things could be packaged together in life skill curricula for both in school and out of school for young people to learn together. And actually several good curricula have been developed, and they're being field tested by some of the NGOs right now. And then girls, of course, their primary school enrollment has increased, but we need to get them to attend secondary school and graduate from it so that they can then go on to science and technology careers and be part of the labor force that will be transitioning our economy from the current one to a much greener one, the green economy that is coming. Of course, we have to continue working for women's rights to land ownership, to other property rights, so that they can have economic empowerment. And of course, we have to also fight for their basic right to healthcare and to medicines. And finally, we really need to call upon our leaders to put more money into climate financing and make sure that all of the gains in global health will not be rolled back from these calamities. I wanted to just list some useful references for anybody who wants to look at this topic more closely. So I listed some of these here. So I'll leave you with this call to action, and I welcome your questions and discussion. Thanks.
Thanks so much, Sono. We really appreciate you being here. I would like to open the floor up to questions. I don't have any in the chat, but do you, the people in the audience, have some questions for Sono? I do have some of my own, and I know there are a couple of people out there that do as well. So until recently, you were working for a foundation that financed this work at the intersection of reproductive health, gender, and climate. Can you give us a few examples of ongoing work that makes these connections and how they're doing their work?
Yeah, so we were supporting a group called Pita Putih Indonesia, and it's an affiliate of the White Ribbon Alliance. They work nationally in Indonesia on maternal, newborn, and child health in about 32 provinces. And they're a very strong NGO. They have a lot of grassroots members and stakeholders. So the support that they got from us, they used to do some desk review of all of the existing scientific articles and medical literature around the impact of heat, excessive heat on maternal, newborn, child health. And they also did some interviews, qualitative research and interviews with women who are on the front lines of suffering some of the impacts of climate change and captured their voices. So with these materials, they did some national level briefings with policymakers. And I'm happy to report that they were able to get multiple government ministries and academic institutions, as well as health professional associations, to really open up and wake up to this issue of how all the wonderful gains over the past could be rolled back quickly if they're not prepared to face some of these climate change impacts. And so it really, each of these organizations was able to make a pledge or a commitment to say, we will do more on this. We want to learn more about climate. And so it really opened up this dialogue across different ministries, different sectors, different scholars talking to each other. So I think it's really not rocket science. I mean, these things don't happen unless there's kind of a very planned and organized way of thinking through what is strategic communications at this time, and how do you move hearts and minds and agencies to work together better.
That's a wonderful example. I know I see a question in the Q&A box. Darby, do you want to unmute and ask your question?
Sure. Thanks, Kelly. So, in a world where people are becoming more apathetic to the world's problems, how do we promote a sense of individual responsibility for all and not just women, particularly with regards to voting and taking political action?
Yeah, I mean, I certainly take courage from a lot of young people, ordinary young people doing extraordinary things these days, really getting out there and talking truth to power, learning a lot about climate and politics and getting involved in local politics. So I think for good or bad, I mean, we visually see climate change happening now much more, and that's really causing people to act more urgently. And I think there is a glimmer of hope, at least currently. The Biden administration is pushing forward a huge package of climate policies and financing through under the Inflation Reduction Act. And that was not something that we thought would ever pass. And so it gives me hope that there are many more people now who care about this issue, and they're caring also about the down ballot races in the US. Those are going to be very, very critical because so many actions could be taken also at the state level and also at the city level, involving local governments as well.
Absolutely. Thank you for that. I see a question in the Q&A from Carolina Cardona. Can you unmute and ask your question?
Sure. Hi, Kelly. Thank you, Sono, for that presentation.
Sure.
My question was related more about whether you can speak a bit about the relationship of chemicals and pollutants with reproductive health. And I think my question is mainly because of a book that I was reading about Countdown that looked at how, but it wasn't in LMICs, it was from evidence in developed countries of how it has been affecting, for example, the quality of the sperm, and that affects also infertility. But I don't know if that has been, or if it's being investigated in the context of low and middle income countries.
Yeah, thank you for that question. It's not a topic that I've delved deeply into recently, but I mean, I think there's just so much research still left to be done in terms of climate impacts on SRHR, reproductive health, but also looking at sort of the fallout of climate change, which is greater air pollution, more pollutants in the air because of the ozone layer. And yeah, I certainly know of the body of work that people have done around infertility, the reproductive health harms of certain chemicals. But I have not recently seen, any major study around that. So yeah, I will have to look into that, but I don't have an answer for you on that.
Thanks, Sono. Who else has questions, please? I know she wants this to be more of a dialogue with the larger group, so please don't hesitate to unmute and ask.
Yeah, I'm just curious what people are also doing, in terms of climate. I know a lot of activists are out there at the school as well.
So Sono, this Oying.
Yeah, anyway.
Can you address the topic area of the impact of migration, a result of climate change, and how that migration patterns might begin to impact the urban centers, and what are the implications of that from a health response point of view?
Mm-hmm.
So that kind of the nexus where it occurs, and then the migration patterns that occurs, and then the response to that.
Yeah, thank you. Migration is going to be a major issue in the next decade. And there's already a lot of migration happening because of climate change. The Central American migrants who are coming into the U.S. border from the south, partly due to climate change as well. So I think there are people studying migration patterns, but I think most importantly, we really do need to think about, and you're really in the midst of all of that, planning for urban health systems and healthcare in the slum areas, and very densely populated areas in terms of how do you work to strengthen the infrastructure, especially of people who are needing to be transported. I feel that urban slums is really the next big challenge for global health service delivery, to think about how then we could design systems that are self-contained and also environmentally sound, and have adequate water supplies, adequate sanitation facilities. All of that, I think, is important, and global health practitioners need to be in conversation with urban planners, city planners, transportation planners, to really think about healthcare in a much more holistic way, so that people can get to health services and use healthcare services in these very different environments. And I also want to point out that I think we have to think about consumption patterns as well. And so when people move from rural to urban areas, their consumption patterns change, their living situation changes, and they will end up having perhaps a bigger carbon footprint than when they were living in villages. And so there are a lot of dimensions of migration that I think we need to look at from a climate perspective, and also healthcare.
Thank you, Sono. Beth, I think you have a question.
The question I have is what you consider to be the best indicators or metrics or results framework related to climate change, and specifically health and women's health. Because there are lots of indicators for the climate change overall, but looking at the more practical aspects, as you were just describing, it's a little bit trickier.
Yeah, I mean, these are precisely the kinds of things that we need to be looking at and coming up with, and really proposing in climate meetings. So I think more and more the global health and reproductive health advocates need to be at conversations around climate policy, so that people are actually thinking and incorporating these indicators into their plans. So I would say, for example, in terms of accessing healthcare, in times of disaster, for instance, I think the emergency preparedness folks have been thinking about, what are the indicators of reproductive health in disaster situations. So there's a set of indicators there. But a whole host of impacts on maternal and newborn health, I think those need to be tracked and shared across countries, so that they can be prepared for when weather patterns start to change. So the heat indicators, especially, I think, are critical for maternal newborn child health. So yeah, I think that's a wide open field that we should engage in terms of coming up with meaningful indicators. and I think COVID also gave us some examples of what happens when healthcare systems get disrupted, and what happens to service delivery, and how do we recover from that.
There was one I saw in a private chat. So what keeps you up at night, Sono? What are what are the most concerning pieces of this work that keeps you up at night? and what are those glimmers of hope? Because you did talk about a couple of those that are helping to kind of alleviate some of that fear.
Yeah, certainly. I think the world that we live in, it's built upon a system of capitalism that is really not working for us. There's increasing inequality between rich and poor. There's also this endless pursuit of economic growth that's not sustainable, and just, you know, for the sake of profits, we keep consuming and making products. And so this kind of endless cycle, I don't know if it could be changed. But that's kind of what worries me, is that we're trapped in the system, and we can't get out because so many things are tied together, and also tied to fossil fuel consumption. So how to get out of that is really the big question. And I think each of us could think of ways to do our own part to consume less, or reduce and reuse and recycle things. So that's kind of where my mind goes to when I'm lying awake at night. And in terms of glimmers of hope, I think more and more people are understanding, you know, green, living green, clean energy use. So I think there's much hunger among people to learn more about climate change. And so there's a big opportunity to do climate education on a massive scale, both for young people, but also for policymakers. And there's definitely hunger for that everywhere that I've seen. So that gives me hope.
Wonderful. In honor of Earth Day, which is tomorrow, I would love to ask the group here, what are those things that you're doing in your own personal lives and worlds, in big and small ways, to do your part to affect climate change? And I'd love to see some of these in the chat, but I'd love for some of you to talk about the things that you're doing in your personal lives, but also in your work lives to mitigate climate change and you know, the things that we're facing, because I know many of you are in the reproductive health world and family planning and such. So I would love to hear from all of you. What kinds of research are you seeing coming out? What or are you assisting with? What kinds of things are you doing that, apart from recycling your bottles and cans or whatnot, what are those things that you're finding some positive repercussions from? Asta?
Sure. Thank you. Thank you so much, Kelly. So, and Sono, thank you very much for the informative presentation. So I am from Tanzania, and coming from a sub-Saharan African country. I do know what food insecurity is. I understand that, and I've seen it while I was growing up. And so and my husband is from Nepal, where they're seeing the effects of climate change on like the snow on the Everest, for example, and that people are not able to climb as much. They're not getting enough food. And so small things, and I haven't done research as much but I'm hoping I can go into that realm at some point. But in my own personal life, what we have been able to do is, for example, single-use plastic. So I live in Delaware, and single-use plastic is now banned. But before it was banned, what I did was I bought like recyclable bags and recyclable. So I was not using plastic bags to put in all my vegetables, for example, During the summer, we have started a garden in our backyard. And so we try and grow our own food so that we understand. And I have a 5-year-old son. So hopefully that will like those messages and those lessons will get transferred to him so that he understands that how difficult it is to grow your own food and to have the food that is available to us, and appreciate that that food doesn't come. It's not easy to just go to a grocery store and just buy it, and that there are many people around the world who are not able to do that, So those are just 2 things that I have done in my own personal life in order to, one, make my son realize that this is a real thing, and 2, like for my own self, so that I feel a little bit better about trying to conserve what we already have.
Thank you for sharing. It's great.
Anyone else have things to share that they're doing, or can encourage others to join them in?
Just an announcement for those that are located in the Baltimore area. The National Aquarium has organized an Earth Day cleanup. And so if you're interested in getting out on a beautiful Saturday afternoon and doing your part in the Baltimore area, I would encourage you to check that out as well.
Thanks, Darby. Anyone else? I did go ahead and put the...
Yeah, I have a question for Sono. So I've noticed in your presentation, Sono, you did not refer to the findings of the Paul Hawken's Project Drawdown, which is supposed to be highly respected, and the findings, of Paul Hawken's research are always highly thought of in the environmental community. So the first results of that Project Drawdown sure identified refrigerants as a huge contributor, but that research also concluded that access to contraceptives, family planning, as by itself, and girl education by itself were also huge contributors to mitigation. And then that research also, they said that when you combine the access to family planning, contraceptives, and girl education together, their value is more powerful than any other mitigants, that was identified in that study. Okay. So in your presentation, you did not refer to that. And from what I heard, there was another follow-on to the Project Drawdown that they're not anymore saying that the findings around reproductive health, meaning access to family planning and combined with girl education, is the big mitigants. Also, although that findings of that research has never really changed, so it's just a question of framing the findings of the research. So what can you say about that?
Yeah, thanks for that question. I believe that there was, certainly the update of the framing, and I think there was some there were some people who really didn't want to put climate mitigation and family planning sort of in the same basket, because they were afraid that that would stir up sort of the old population policies and family planning policies that were coercive and not rights-based. So I think there was a lot of debate, discussion, and Project Drawdown decided that they also wanted to re-examine some of the data. They didn't really have much time to do that, and so they decided that reframing would be a helpful way of talking about family planning in relationship to climate. And I think the drawdown message from the original report did reach a lot of people, and a lot of donors I talked to, a lot of philanthropists, are still very much supporting girls' education and family planning together as a package for overall global development and health priorities. So I think that message did get through the first time around and left an impression on people. So yeah, in terms of whether it moved a lot of climate funders to the cause of reproductive health, girls' education, it is yet to be seen, because I think a lot of climate donors are still very focused on other aspects of mitigation, the ones that seem to be easily solved with technology.
Wonderful. Thank you so much. I believe Christina has a question.
Yes, thank you, Kelly, and thank you, Sono, for this webinar. It's been very insightful. One thing that I wanted to ask was, we launched what we're calling the Family Planning News Network at ICFP 2022, and we're very excited to bring that to other events this year, including Women Deliver. And Women Deliver, as we all know, is really highlighting climate change and the intersection of gender equality. And so I'm just wondering if you have any thoughts about how, as we start to build out this media advocacy news network, how can FPNN help elevate the voices of individuals or communities that are most impacted by the intersection of SRHR and climate change, and what stories or perspectives might be important for us to highlight at the conference in this July?
Yeah, thanks for that great question. I'm going to Women Deliver as well, so I'm looking forward to this conversation continuing there. I think it is important to get the voices of women from the front lines who are especially experiencing healthcare challenges, and also as we discussed, food insecurity issues, as well as water shortages. And the current drought is really affecting a lot of healthcare systems. So I think healthcare workers mainly would be also good targets of people to interview and highlight. And I would be really excited to hear from some of the climate policymakers as well, in terms of how they look at their work intersecting with health, intersecting with women's rights, really challenging them to always think multi-sectorally and not just stay in their sort of mitigation, energy sector kind of silos. And creative financing solutions, right? So I think we need to really think about better taxation policies and thinking about where that $100 billion would come from to support all these climate priorities.
Wonderful. Thank you. Yes, we will follow up at FPNN at Women Deliver, and look forward to speaking with you there too. Thank you.
Yeah, great. Thanks, Christina.
Any other questions from the group? Please feel free to unmute yourself.
I'd like to listen to more questions, but if there are none, I have some comments later on. But I'd rather listen to others. Yeah.
But yeah, oh yeah, I'd love to hear your thoughts though on the urban health issue, because with really all of the migrants coming in potentially to cities to escape drought conditions and failing agricultural lands that have to be abandoned because of extended droughts. So do you see cities, mayors, urban planners thinking about this massive influx of potential vulnerable populations? And yeah, are you hearing any talk within the TCI project?
So yes, certainly. My own personal opinion is that there is no tracking data to show, the magnitude of the migration as a result of climate change, because sometimes the climate change and economic necessities, are cannot be dissociated with each
Right.
other. But I personally believe that the numbers are probably becoming huge compared to the areas where the IDPs are actually found. Like the Rohingya, you have a certain place where they are,
Yeah.
right? But I wonder what percentage of that are actually moving into the urban centers in Bangladesh. Nobody is counting. There is no research, around that, and that's probably happening. So now the question is, from a political point of view, if you take the case, say, of Philippines, the politicians care about the votes. So if they move, from the disaster areas into urban centers, they end up in the urban poor settlements. And
Right.
when they are able to vote, that's what the politicians care about. In fact, most politicians survive and develop dynasties simply because of the votes of the poor people, in many of the urban slum areas. It's not the rich dictating, who gets elected in local government, but it's the huge numbers of people, in the poor areas. So that politics has not yet been fully studied, and how that can be turned around in favor, of the health issues and climate change issues, that we have. There's lots of potential there. But since you gave me this opportunity, so you probably remember our friend Brian O'Neill, from NOAA, scientist at NOAA, who did a study that was funded by Hewlett Foundation, I believe, many, many years ago. So in that study, the challenge was, can Brian take a look at the IPCC formula and related to climate change? And it turns out, to the shock of everybody, the IPCC formula did not really include population as a factor, in the IPCC formula, which contradicts the very fundamental notion that it itself, the IPCC, is saying that climate crisis is mainly driven by human beings. So if it's true that human beings drive climate crisis, so why is population not an important factor in the formula? Okay. Then Brian, if I recall, did some simulation studies. What if unmet need, were fully met? So he simulated that and used the Princeton 14 wedges model of reducing CO2 by 50%. And what he discovered is that meeting unmet need fully was equivalent to all of us in the world driving cars will shift to driving electric vehicles. Just imagine that, mind-boggling. But the cost of changing all our habits and the ability to produce the electric vehicles is probably quite enormous beyond imagination, right? But the cost of meeting unmet need is probably a drop in the bucket compared to that, okay? And then he made another startling conclusion that one wedge, is equivalent to stopping deforestation right now with a click of your finger. Deforestation stop, and that's the equivalent of the impact of meeting unmet need. So, in other words, again, you're seeing there the relationship to population that people just conveniently don't want to address because it's not in the way some people, the inventor world like to think. They think somewhere else. If you start thinking about population, they will start thinking about reproductive health. They will start thinking about family planning. That may not be in their agenda. Their agenda is something else, right? So it's just funny from my point of view that we hide, from this factor that what if we just start the word using population and therefore that's equivalent to coercion. We know that over the years we have gone through that already. So that bugaboo, in my opinion, was probably there 20, 30 years ago. It's not as relevant anymore in this day and age, but it still persists. So that's just my comment. I wonder whether you want to make an observation of that.
Yeah, no, I think population dynamics is critical to any climate discussion. And, that includes migration as well, and aging and fertility patterns, early marriage, things like that. So I think, again, there needs to be conversations happening between demographers and climate planners. And I don't think that's happening as frequently as we hope. And I think, as Drawdown talked about, family planning and girls' education in combination is super important. And so things like delaying early marriage or eliminating child marriage, I think that also has a big impact on fertility. And so I think it's multiple ways we could advocate for the need for family planning, as well as for empowering women and girls and girls' education writ large. So yeah, I do think that there's a need to talk about population, but in conjunction with women's rights and girls' education as well.
Thank you for that, Sono. And
Yeah.
thank you for your time today to come and share with us all of the work that you've been involved with, and the concern and insight that you have around this particular intersection of our work and the environment. I am wondering if you could talk a little bit about your upcoming Earth Day event. I have I'll put the link in the chat for people to register for that, but talk a little bit about your next talk on Monday, kind of sandwiching Earth Day in there, and what people can expect if they were to join that one.
Yeah, I think that panel is going to be at UC Berkeley, and it features Ndola Prata, professor there, who is at the Bixby Center, and she, of course, has studied this issue, implemented programs for many years on the intersection of gender, climate, and reproductive health. She's also teaching some classes on that. And then Pathfinder has a long-standing relationship with UC Berkeley. I used to work at Pathfinder, and they have been at the front lines of designing family planning service delivery programs in times of disaster, like the one in Pakistan. So I think it would be really great to hear from them actual implementation challenges and successes they have had in preparing for disasters, as well as actually delivering services in disaster areas. So yeah, it would be a very interactive one, as we will be live in front of a live audience together on a panel physically and also virtually as well.
Wonderful. Well,
Thanks.
thank you so much again. We greatly appreciate it. And to all of you, happy Earth Day, and may we see some really fantastic progress in the near future. So thank you. We'll talk to you soon. Take care, everybody.
Thank you, everybody.